pass through which makalid pud siya into bowel ischemia. Next is the hiatal hernia. Hiatal hernia is a weakness of the esophageal hiatus that permits some portions of the stomach to herniate into the thoracic cavity. It occurs about half of the population over the age of 50 years. So, sa hiatal hernia is ang imong esophageal hiatus kay niabot na siya sa thoracic cavity. But again, sa akong gaingon ganiha, kung early stages pa sa hiatal hernia, which is reducible siya, so pwede pa siya balik on its original position or normal position, but with butangan mo siya og slight pressure para magkahinay-hinay siya, like i-push mo downward pressure para magkahinay-hinay siya og balik. Then, if chronic herniation siya, which means chronic if kanang dugay na siya, manang maglisod na pud kag balik, so need na siya og surgery. Next is the types of hiatal hernia. First is the direct or sliding hiatal hernia. It occurs when a portion of the stomach and gastroesophageal junction are both situated above the diaphragm. So this type of hernia constitutes the outstanding 99% of all hiatal hernia, which naa siya makita nga Scotch key ring, which ang ring nga nakapanaro sa esophageal opening, which mo naglisod ang food intakes nga makapass to our stomach. It also consists of a mucosal ring that protrudes into the lumen. Second type is the rolling or paraesophageal hiatal hernia. It is a far less common type of hiatal hernia. It occurs when a portion of the stomach or adjacent viscera herniates above the diaphragm, while the gastroesophageal junction remains below the diaphragm. So if all stomachs lies above sa atuang diaphragm, so ang stomach nimo na ibabaw sa diaphragm, magka intrathoracic stomach, which means ang stomach kay mo to niabot sa atong thoracic cavity through the hiatus. Then the paraesophageal hiatal hernia is potentially life-threatening. So pwede siyang ikamatay sa tao because of the risk of volvulus or the twisting of the stomach, which kung matwist ang imong stomach, na instances nga dili na siya maka-perform sa iyang role. Then, incarceration, which trap herniated stomach, and strangulation of the hernia, ma-compromise ang blood supply. Next. So, muna siyang causes. First cause is the congenital weakness, aging and loss of muscle tone, physical strain, chronic cough or sneezing, chronic constipation, obesity or pregnancy, previous abdominal surgery, trauma or injury to abdominal muscles. Signs and symptoms of the hiatal hernia is sometimes it can be asymptomatic, but also sometimes kay kanang ubanan siya of reflux, heartburn, visible bulge or swelling under the skin, nausea or vomiting, heaviness or pressure sensation in the affected area, tenderness or redness over the hernia site. Then treatment niya is life cycle changes, which is mag-exercise ka and healthy foods ang imuhang kanon. Ultras, analgesics, herniorrhaphy, hernioplasty, and laparoscopy. Next. So this is the example of imaging modality. In the first picture, this is an example of inguinal hernia, which is common in men. This is a computed tomography of inguinal hernia of a 96-year-old man. Also well defined are the femurs, showing the lesser trochanters projecting posteriorly, and the ischial tuberosities. And the next picture shows the computed tomography demonstration of a large anterior abdominal hernia containing multiple loops of bowel and possibly some large bowel without evidence of obstructions in this 70-year-old man. So, dili siya makita diri nga nadjud ay naka-obstruct. But then again is wala na siya murag wala na siya ga-bulge out. Next. So, this third picture, then kaning picture A, this one, is an upright abdominal view of a 3-month-old indicates multiple dilated loops of bowel with air and fluid levels present suggesting a mechanical bowel obstruction. And this second picture, picture B, is a prone cross-table lateral views shows the small bowel forming a beak-like projection at the point of obstruction in the internal inguinal ring in this incarcerated hernia. So makita ni mo ang murag ka na big bitaw cage. Next. So this is the fourth picture sa picture A, it demonstrates the contrast material above the hemidiaphragm on an upper gastrointestinal series of a 51-year-old woman. Then the picture B, the esophagus narrows to the stomach, which is seen to be empty possibly above the hemidiaphragm in the sliding hiatal hernia. So, as makita ni mga yung esophagus kay nagka-gamay siya patulong sa stomach, but then again kapas through ra ang food nga on its own way. Then next is the katong scratching ring present sa inguinal. Muna siya kini arrow to demonstrate in the case of sliding hiatal hernia kini na arrow sa kuan. So, this picture A is the paraesophageal hiatal hernia, demonstrating narrowing in the fundus. And the picture B is the lateral view of the same patient, demonstrate the cardioesophageal junction in its normal place below the hemidiaphragm. The fundus is highlighted by radiolucency of the lung. Then, this picture is the intrathoracic stomach, which is katong ang imong stomach kay ibabaw na siya sa imong diaphragm. It is indicated by the presence of the entire stomach above the diaphragm. So, ito kong giingon. Also with malrotation, which is discussed by previously ni Grace, and malrotation of the stomach. Next. So, our next topic is the bowel obstructions. So, as we all know, bowel obstruction is a condition in which the normal flow of intestinal contents is blocked or kanang partially blocked, which is dili tanan ang makalusot pero naiuban. Then completely blocked or kanang wala jud oy bisag usab-bisag blood nga maka-pass through. This bowel obstruction prevent the food, fluids, and gas from passing through to the intestines. Both the small bowel and the large bowel of the normal person are nearly always active in the peristalsis. There are two types of bowel obstruction. Kindly read the first type, Grace.
Mechanical bowel obstruction is one in which the lumen of the bowel becomes obstructed.
So, meaning ang intestine is na siya oy nag-bulge out. Then second ay sa mechanical bowel obstruction is naanap siya ilaing types of mechanical bowel obstruction. First is the simple mechanical obstruction. It does not involve in the blood supply to the bowel. So katawag gingon ganiha nga na siya naka-blockage pero pwede ra makapass through ang dugo. Then second is the strangulating obstruction may lead to bowel infarction. Most are caused by incarcerated hernia. So strangulating obstruction, kato na siya, na-obstruct na siya completely. The causes of the bowel obstructions, first is hernias, tumors, volvulus is katong mo twist ang one part of the intestine slides or folds into another part, like mura siya o basta malukot gani na siya. Then intussusceptions is mura siya magtambaw, like ang part sa intestine nga kani is matambaw siya sa pika, so ma-fold siya. Then post-operatively, adhesions, gallstone. Ang gallstone ileus, kabalo mo sa gallstone ileus, na siya condition nga, as we all know nga gallstone, meaning bato sa gallbladder. Gallstone ileus is a condition that the gallstone may erode in the gallbladder, of course. But it can lead to obstruction kung maabot na ang gallstone sa atuhang ileocecal valve. Then, signs and symptoms is abdominal distension, abdominal cramps, vomiting, progressing to bloody stools. Then, treatments niya is NPO or nothing by mouth, the IV fluid therapy, nasogastric NG tube, decompression, and surgical procedures. Second type of mechanical bowel is the paralytic ileus. It is also known as the adynamic ileus. It is a failure of normal peristalsis. So the intestine fails to move contents due to the loss of normal peristalsis. So as we all know, ang peristalsis ang nagdala sa atong intestine para ang musulod niya is magpadayon or ganig move. So if mo stop ma-fail ang normal peristalsis, which means na dili na pwede makapa-move ang mga food intakes nga naabot sa atong intestine, so ma-block siya. Then, causes niya is surgery, due to surgery, intraperitoneal infection, bowel ischemia, certain drugs, electrolyte imbalance, pancreatitis, reaction to any stressful illness. Signs and symptoms: distension of the abdomen, abdominal cramping, and vomiting. Treatments includes nasogastric suction, medical stimulation of the bowel, colonoscopic decompression. So, ang paralytic ileus is generally